We're ready.
Welcome, and thank you for joining us today. This is a question and answer session for January 29th. Public Health Director Annette Rodriguez and Dr. Chris Berg are addressing questions received this week. Please feel free to add your follow-up questions to chat. Today's questions focus on Robstown Mega Clinic and the masks in 2020.
Okay, so Annette, it looks like you're smiling. Did things go well this morning at the Mega Clinic in Robstown?
Things went really well. We ended up putting 2 clinics together, so because there's going to be a gun show here tomorrow, and we didn't want the traffic mess that we've seen in the past, and so we did, just under the 5,000 doses. We took some out because we're going to use some at the American Bank Center next week. But we also did the second drive-through, which is the second dose vaccine clinic from December 29th. It's time for their second doses. And that's the line you see behind me. So these people got what's called a magic link, and they clicked on it and they registered themselves and they all came back. And so they didn't have to wait in the long line with the other 4,000 something people. And so we're really excited for them.
Oh, that's fantastic. Okay, we have a few questions here. They should be pretty easy because they're mostly about the clinic. But the first one, and you might have already answered it, can I receive my second dose earlier than the scheduled or recommended?
For both Moderna and for Pfizer, you can receive it actually 4 days before the date. So for Pfizer, it's 21 days after the first dose. For Moderna, it's 28 days after the first dose. So respectively, you could actually start on day 17 and day 24. But I really wouldn't encourage rushing, So as soon as we get your second dose, if you've been here at one of our mass vaccination hubs, we will contact you. So we will contact you through your cell phone. We will also reverse alert you if you have a landline. You just have to pick up the landline, or we'll leave a voice message if you have a voice message capability. So, and then you can come and get your second dose.
Okay, and now if you scooch over a little to the right, we could see your whole face. There you go.
Okay.
Perfect. We want to see the cars, too, going through and getting vaccinated. Thank you for that. All right.
You're welcome.
The second question, if I couldn't confirm my appointment for my second dose online, what time should I arrive?
So if you're talking about the second dose for today, it's any time between 11 and 7 p.m. So we'll be here till 7 in case people have to work, and you can get your second dose at that time.
Okay, 11.
Not after 7. We'd like to close. We've been here since 4 this morning.
Right. So do you close at 7, or should they show up by 7?
No, we close at 7.
Okay, so show up before 7.
Before 7.
Yeah, okay, good.
Exactly.
All right. How will the second dose traffic be able to avoid the traffic from the first 5,000 doses?
So the first doses are coming in through County Road 40, and the second doses are coming in front of the Robstown Keach Library, which is Carrie Shanty Boulevard, and they're coming in through there. So they have their own traffic pattern to come into the fairgrounds, and we're actually in a different show barn than the other 5,000 first doses.
Okay, yeah, and you've given out all the doses, the first doses today, right?
Well, we've already closed the gate. We're still vaccinating the first doses, and we started the second line because it's already after 11. But we started actually about 15 minutes early.
Okay, I understand. Thank you. All right. If I wait in second dose traffic for my first dose, will I be turned away from the second dose lineup?
Absolutely. You'll be redirected to go back behind the first dose people that are all lined up and have been here since yesterday. So yes, nobody could be in second dose lineup except second dose people.
Right, and even then, basically, if you get into the second dose line but you're a first doser, I'm guessing that by the time you got to the front, there wouldn't be any ability to get in the line today. They'd probably have to get in some other day.
Right. You know what some people are doing is we have first and second doses in the same car, of course. It's not always going to be easy, but they're actually in the first dose line. So when they get to the front of the first dose line, we just told them to let us know because we're using second dose vaccine. It has a different lot number. And so we'll go across the show barn and we'll go vaccinate them with the second dose.
Okay. And just additional clarification, what if that mixed car with first and second doses is in the second dose line?
is in the second dose line, then they're going to end up we're going to redirect them to the first dose line, and then we'll do the same thing with them.
Okay, so you really, if you're going for first doses, if there's any first doses in the car, then you want to go to the first dose line.
That's correct.
Okay, got it. Will there be other vaccine clinic sites?
Will there be other vaccine clinic sites? Yes, actually next week we're going to pilot what we're calling a sub-hub, and that's going to be at the American Bank Center. We're planning it for next Tuesday.
Okay, next Tuesday, American Bank Center. How will we be vaccinating the homebound population?
The homebound population, we're fortunate enough that we're working with CC Fire Department, and so they're actually working with the Parks and Recs already have seniors that are signed up that are homebound, that they receive Meals on Wheels, and so they're working through that program, and they actually go to each individual's home, and then they wait the 15 minutes in case they have any kind of adverse reaction. And so it's a really great program because we understand you're homebound, you can't come out to a mass drive-through event, and so they're helping with us in that respect. Okay,
thank you very much for answering that. Okay, the next topic is on masks in 2020, and I'll handle the first question, and Annette, you might have additional follow-up on it, but the question is, when ordering food via curbside and drive-through service, are masks necessary or optional? And I'm known as the king of curbside, I guess, on the task force because I like curbside. I wish that it continues and you don't have to pay for it after COVID's over. I like not having to go into the store. You should definitely wear your mask. It's necessary. Because you're going to have that interaction. They come up to your door and you have to roll down the window, and that employee is wearing a mask. First of all, if they're wearing a mask, then you should be wearing a mask. Second of all, that employee, they're going up to a lot of cars, and every car they go up to, even though they're wearing a mask, there's still some chance of contracting COVID, and so that adds up over time. And so you don't want to contribute to that accumulation of risk. And once the employee, if an employee does become infected, then they're going to encounter a lot more people than maybe the average person in the population, which could spread it even more. So there's a lot of reasons why, even if you're thinking, well, it's just the drive-through or it's just curbside, you should still put on your mask. And I know now the federal task force is recommending that you wear 2 masks to further decrease the risk of transmitting COVID. So, Nat, do you have any follow-up?
Yeah, the only thing I can add to that is, the other thing that I always think about is what if they come out to deliver my plate and they don't have a mask on? So I always make sure that I wear my mask. And the other part to that is it's just courteous, to show them the same courtesy. They've been wearing these masks all day. They're sweating. They're going back and forth. They're delivering plates to us. It's just a common courtesy. Put your mask on.
Yeah, that's a good point. Okay, the last question, and this is pretty open-ended. I'll start by asking Tiffany and Jason. We'll go Tiffany, you first. Hindsight 2020, what would you tell yourself a year ago? If you could go back in time.
Nothing.
Right now it's COVID is
I wouldn't tell myself a thing.
Not really on the radar of most people. You just not tell yourself and wait for yourself to be surprised.
Yeah, it's best that way.
Okay, Jason?
I would probably tell myself that it's not, the world isn't going to end. There's hope. We're going to get vaccines. We're going to get through it. And nothing new under the sun, and this isn't either. And we will overcome.
Annette?
A year ago, we were already planning for this to come. And so we knew when public health was coming. We had already opened our department operations center. But what I would tell myself now that I know now that I didn't know back then is I would tell myself to exercise every day because I'm sitting in front of a computer all day long.
Sounds cutting out.
Yeah, we lost you.
I have some COVID pounds on me now, and so looking back, I would have just kept moving, because all these Zooms and WebEx, I didn't have to get in a car, I didn't have to go to a meeting, I didn't have to come back, and so these extra COVID pounds are killing me, and I would have just kept moving around and kept exercising if I had known.
Yeah, I agree with you on that, but I'm thinking back, and I don't think there was time to do that for myself. Like
I think we have to make time. It's so frustrating because it's already tough enough to be in a pandemic. It's much tougher when you're battling weight as well. And then the anxiety of being overweight. There's just a lot that are connected, and so I really wished I had just made time, even if there was no time. Because I've learned now, I can Zoom without the camera on, and I can do jumping jacks. I'm learning, I'm figuring it out. Anyway.
Yeah. So I guess for myself, my message to myself would be really enjoy that ski vacation that you're going to take at spring break, because it's going to be the last one for a long time.
There you go. That's a good one.
And luckily, I did really enjoy it, so I did it right. So that's all the pre questions that we have, or pre-planned questions. Have we gotten any additional questions from online viewers?
Oh yeah. Where to start? Some of it will be addressed in your report this afternoon.
Okay.
So
you can ask them.
Let me just pick one. What's the current hospitalization trend in terms of that 15% capacity mark?
We're staying below the 15% mark. At this point, if things stay the way that it looks like they're going, it doesn't look like we're going to eclipse the that 15% threshold for 7 days in a row. I will say that part of the reason why we're staying below it is the hospital capacity has increased by about 100 patients over the past week or two, and so we're operating at a higher capacity, and it seems to be especially focused in the ICU. So I think there's more staff in the ICU and the hospitals in the Coastal Bend right now, which is helping things.
Great. How has the month of January compared to months prior in the pandemic? Seems like we've had daily reports of more cases and deaths this month.
Go ahead, Annette.
Well, I was going to say, I really have to look at those numbers because what do I remember from January? That they had not reached the height of December yet. So I'm still looking at them to see, are they going to reach December's numbers, or are they going to start coming down? So I have to go back and look at those numbers.
Okay, yeah, I would say that for us in the Coastal Bend, January has not been as bad as July. July was our worst month here in the Coastal Bend. There's been no month that was worse, unless you want to go to June or August. But that summer peak was worse for us than the winter peak, at least in terms of its heights. In terms of the rest of Texas, that's not necessarily true. For most of the rest of Texas, January has been particularly bad and worse than the summer. And the exceptions there would be Northwest Texas, which had a pretty bad fall. But that's the best I could answer that without having the data in front of me.
Okay, where were we? When did this current surge start, and what's the forecast for when it may end?
The current surge started in the middle of October. And there were little lulls at Thanksgiving. It let up for a little bit before the surge came in again after Thanksgiving. And actually, my latest data is indicating that in the middle of January, or near the beginning of January, we had a second kind of letting up of the surge. And at this point, my big question for today, and I'll have two model projections. One is that the surge is lessening, and the other is that it temporarily lessened and is back. And I can't tell the difference between those two scenarios right now, but October is when this started.
Tiffany, you're muted.
Yeah, we can't hear you, Tiffany.
What is the status of the new UK or the South Africa variants in the coastal bends?
I'll let Annette handle that.
Yeah, so for the UK variant, the B117, we only had the one case. That was the second case in the state of Texas, but there have been many more cases in the United States since then. And so we continue to watch it because we know that it's, more transmissible. It can infect more people. We don't believe that it's more viremic still at this point. The one that we really are more concerned with is South Africa or the Brazilian variant.
And I have a follow-up question on that before I address it, and that would be, do you know how many of the coastal bend samples have been sequenced?
No, that's a great question. We send off two samples every other week, but we're just one of many. So we're sending them off, and they go to DSHS to sequence, and then they go to CDC to get sequenced. But these are just random. So we just randomly, take some, and then we send them. But everybody's doing that, and that's exactly how this this man that was recognized as the second case in Texas, that's how he was picked up as well.
He was picked up randomly, not because he traveled to the UK?
No, random.
Wow.
It was a random.
Wow, that's an amazing coincidence. So what I would say at this point is that the UK variant, there's enough evidence from other locations, given that there's not a lot of sequencing occurring in any one location in the United States, that it's around. It's endemic in the United States. It's spreading. I've seen many accounts of people that had it that didn't travel to the UK. So that indicates that it's spreading locally. I think yesterday I read that in South Carolina, the South African variant was detected there, and in both cases it was community spread. Those people hadn't traveled somewhere, and so that indicates that the South African variant is in the United States also. So they're here and they're around, and the way to be safe is to operate like that's the variant, like those variants are here in the coastal bend, and you want to be cautious.
I think the other part to that is that the vaccine is one way to mitigate the spread of this virus. And so encouraging people to get vaccinated. There are other ways that we've all heard of 1,000 times, and that's the public health strategy: washing your hands, social distancing still from people, and wearing a mask anytime you leave your home.
Yeah, exactly. And you made me think of something in that. Another reason to get vaccinated, and also to keep the number of infections as low as possible, it's not just to limit the load on the hospitals, but also the more COVID there is, the faster these variants can evolve. And so one of the reasons why we want to keep the COVID numbers low is so there's a less chance, less opportunity for even newer variants to evolve that cause even more problems.
That's absolutely true. Thank you.
Yeah, this virus has so much dirt on us. Like, they know all our
secrets.
Yeah, it's learning.
Responses, secrets.
Right.
So I have one question about homebound vaccinations. What if you're a homebound senior with no Meals on Wheels? Okay, if you're not on Meals on Wheels,
right,
if you're not part of that program.
Right, and we're going to address them as well. We just needed to start somewhere. So we started with a program that's already in place, but we're definitely looking for all the homebound individuals, and we're, setting up the processes to be able to go to you and get you vaccinated.
Okay, thanks. Are you planning on giving out the Johnson & Johnson vaccine to seniors?
Absolutely. So once we see what the phase 3 clinical trials look like, then we'll know the age group, we'll know exactly who it's targeted for, and we'll start, if they send it, we will give it. So.
Let's see. Are there any new hotspot locations you've become aware of within the past month?
It's everywhere. That's all I can tell you. COVID-19 isn't specific to one place. You might see a little 2 or 3, people here or there, but it's everywhere. A lot of it's still within households, and that's unfortunate because I tell everybody it's not diabetes, it's not genetic. You don't have to give it to your whole family members. Just isolate yourselves from them and don't give this virus to them. I have a daughter that actually was positive with COVID, and unfortunately, she's still struggling. She's going to be one of those long haulers. She struggles with anxiety. Her heart seems to race. She seems to get a lot of heartburn. Definitely fatigue very, very often. Comes and goes, chills, temperatures. It's really sad. I mean, under the age of 30 to have to go through all of that. And I'm thinking this virus needs to go away so maybe you could get back to your previous health. But it's very unfortunate. So please don't give it to family members.
Or anybody else.
Or anybody else, absolutely. But family members are where we're seeing all of our trends currently.
Yeah, and I'd say if you want to see hot spots around Texas, you can tune in later today for the pandemic forecast, and we will detail that, or you can find it later online.
Thank you. There's another question for you, Dr. Bird. Will you eventually factor those who have been fully vaccinated into your projections?
Yes.
Yes.
But not this week.
Sweet. But not this week.
Yeah. It shouldn't make that big of a difference yet, but it's something that we're working on. So we want to make sure we've got everything in place and that we don't make any mistakes when we roll out to the community projections based upon vaccinations.
Okay, thank you. How many more samples can we get sent out to get tested for variants?
Again, CDC basically set the parameters for us, and so it's a percent of what we're collecting, and so I'm sure it's based on what their capacity is, and so I couldn't give you a total number for Nueces County or even the state of Texas, but CDC set those parameters, and then we just abide by them. We definitely need more genome sequencing. It would be really nice to be able to genome sequence more so we could actually pick up if there's variants, especially like South Africa or Brazilian, as quickly as possible, and then isolate them quickly, and then contact trace them quickly and make sure that it doesn't spread any further.
Yeah, and I'm reminded of a question that Judge Canales got asked in the middle of the summer about which zip code was worse than which other one. And I think that her answer applies here also with the different variants. And it's basically like, COVID's here, these variants are here, whether we know what percentage of the cases are which variant isn't really going to change anything about the recommendations that we're making. And that you need to, that's why I'm saying you just treat it like it's definitely here and treat it like everybody has one of these exotic variants or more virulent variants that is something that we don't want to contract. So ultimately there's just not enough money to be able to do the sequencing for all this, the millions of samples that are getting done in the United States. It costs a lot of money to do genome sequencing.
Mm-hmm.
And it's not like anyone in one zip code the majority of anybody in one zip code doesn't stay in that one zip code unless they're homebound.
Right. Yep.
We're all over the place.
Right, and we see more cases like in 78415 or 78414, but those are also the biggest zip codes. So, you know, I mean, you have to really look at them a lot closer, but you have to have time to analyze the data.
Yep. That, you know, I'll point out there that in terms of fatalities from COVID, Brooks County in the coastal bend has a higher rate than most of the other most of the other counties, and Nueces is actually not the highest rate. It's you know, kind of middle of the pack, but that's not an indication of hot spots. That's I don't know, maybe an indication of access to care and people's willingness to get treated for COVID. But you know, hey, if you're not in Nueces, you're in one of the other coastal bend counties, it's still important to seek medical attention if you do get infected with COVID.
A few more questions. Is the survival rate coming off a ventilator still around 20%?
Yes, yes, it is.
Yes.
Which is very sad, but it is. So the trick here is not to get COVID at all. So if you don't get COVID, you won't be in the hospital, you won't be in ICU, you won't pass away from COVID. So really protecting yourself is the key. And getting vaccinated would even be better if you're in one of the eligible groups, the 1A, frontline workers, or the 1B, which is 65 years of age and older with no comorbidity. It's just an age factor, because those are the people that don't do as well. And then over the age of 16 with at least one comorbidity that puts you at higher risk if you were to contract COVID-19.
I know I read an article recently that indicated that they're using blood thinners, and that makes you less likely to need to go on a ventilator. So the medical establishments' ways of treating COVID and avoiding the worst outcomes continues to develop and improve.
Right.
Closing question. Do we have any info on if these new vaccines are effective against the variants?
So everything that the intel that we're getting is that yes, that they're still effective from these particular variants. But again, like Dr. Bird said, it's mutating all the time, and that's why we're trying to mitigate it. We're trying to stop the spread of the virus completely, because as it continues to spread, it continues to mutate. As it continues to mutate, it becomes a variant. And then it could actually change completely and become a whole new, different virus altogether. And we do not want to start this over again.
Agreed.
Yeah.
I'd like to go back to normal.
I'd like to throw my mask in the air. I would like to do that too, but it's not time quite yet. When we tell you, we will all do it together outside and everybody can take pictures.
Thank you for answering these questions. Thanks for helping us through a pandemic.
I hope the line, we're continuing to move as we spoke, so, it's a little operation here, just so you see. We have nurses over by the door, by the garage door. There's nurses out there. There's only one station. And if you looked at the first dose station, there was at least 12 tables with nurses. So this is much smaller, but they're a little bit more relaxed. They're on their second dose. They're, they're just excited. They're excited. They're excited to get their second dose behind them. We're just reminding them, don't throw your mask away just yet. So we're going to get there. We just need to get there together.
How many vaccines would you say you could do in an hour? Your operation?
Pretty easily, 600. So, I do start screaming a little bit when we're slowing down, but, yeah, we usually have 40, 50 nurses at that point when we're doing 60 an hour. So it's a little bit more laid back today. So it is cool. It's a little cooler. It's getting hot. We're already starting to peel our jackets off. But it's a beautiful day, and I think everybody's just excited. We're excited because when we receive it, you know what, it's a lot of work. We're blessed to have any vaccine here in Nueces County, and so we want to get it in everybody's arms as quickly as possible. We just have to follow the rules of phase 1A and 1B.
Are we going to try to outdo Dodger Stadium?
Absolutely. They just need to send me the vaccine. You know I am. So I have a little bit of a competitive edge to me. So absolutely.
Hey, for those that don't know, Dodger Stadium was able to vaccinate 7,800 people in a day, and I challenged Annette to be able to outdo them because I seem like we probably can here locally.
Right. We've done easily over 5,300 in a day. So our day was over at 5 o'clock. So yeah, I'm up for the challenge. Send me the vaccines. I'll get it done.
Can't let those Californians outdo us.
That's right. There you go.
You know, on that note, on behalf of the entire Coastal Bend, thank you to you and all those volunteers that are out there working so hard. You're making it happen, and thank you for that.
Thank you, Jason. I appreciate that.
So on that note, thank you everyone for tuning in today. The next task force report will be uploaded today. I didn't actually talk to Dr. Bird about when, but sometime this afternoon to social media. Please join us every Friday at noon for the question and answer session. And please remember to direct questions or comments to @CBCovid on social media. Have a wonderful and safe weekend.
Thank you.
Thanks for your questions. We had a lot today. That was fun.